Breastfeeding a newborn in the first week after birth can feel both exciting and challenging as both mother and baby adjust to this new routine. Here's a detailed guide to help make the experience smoother. 1. Start early. Initiate breastfeeding within the first hour after birth if possible. 2. Latch properly. Positioning is crucial. Bring the baby to your breast and ensure they latch onto the areola and not just the nipple itself. A deep latch helps prevent nipple soreness and ensures effective milk flow. 3. Breastfeeding positions. Try different positions to see what's most comfortable for you and your baby. Cradle hold. The baby's head rests in the crook of your arm while you support their back with the same arm. Football hold. Tuck the baby under your arm with their body along your side. This position is often great for mothers recovering from a C-section. Side lying. Lie on your side with the baby facing you. This position is useful for nighttime feeding. 4. Feed frequently. Newborns have tiny stomachs and need to feed every 2 to 3 hours or about 8 to 12 times a day. Frequent nursing also stimulates milk production. 5. Watch for milk transition. In the first few days, you'll produce colostrum, a thick, nutrient-rich milk. By day 3 to 5, your milk supply will start to increase and transition to mature milk. Your breasts may feel fuller or firmer, which is normal. If they become too full, you can express a little milk to make latching easier for the baby. 6. Burp after feeding. Since babies can swallow air while feeding, gently burp them after each feed by holding them upright and gently patting their back. 7. Cluster feeding. It's normal for babies to have periods where they want to nurse more often, usually in the evenings. This is called cluster feeding and helps boost milk supply. 8. Stay hydrated and eat well. Drink plenty of water and maintain a healthy diet rich in nutrients to support milk production. You may feel more thirsty and hungry while breastfeeding. 9. Take care of your nipples. Soreness is common in the first week. To avoid nipple damage, ensure the baby is latching properly. After feeding, let some breast milk air dry on your nipples as it has healing properties. Thanks so much for watching. If you found this video helpful, don't forget to give it a thumbs up, share it with other new moms, and subscribe for more helpful tips.